House will come to order. Please join Representative Basenecker in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Mr. Gregorio, please call a roll.
Representatives Amabile, Bacon, Baisley, Benavidez, Burnett,
Here.
Byrd, Bockenfeld, Basenecker, Bradfield, Caraveo.
Oh, she's excused.
Representative Caraveo is excused. Carver, Catlin, Cutter, Doherty, Duran, Representative. Oh, I got her. I got her. I got her. Escar, Exum,
Up there.
Representative Exum. Representative Exum is excused. Froelich,
They're good if because they have the special.
Geithner, oh. Gonzalez Gutierrez, Gray, Representative Gray. Representative Gray is excused. Hanks, Herod, Representative Herod is excused. Holtorf, Hooten, Representative Hooten is excused. Jackson,
Here.
Judah, Kennedy, Kip, Larson, Lontine, Luck, Lynch, McCluskey, McCormick. Representative McCormick is excused. McKean,
Right here.
McLaughlin,
Ray just jumped off.
Representative McLaughlin is excused. Michelson Janae,
Present.
Mullica, Neville, Representative Neville is excused. Ortiz,
Here.
Pelton, Pico, Ransom, Rich, Ricks, Roberts, Sandridge, Representative Sandridge. Representative Sandridge is excused. Sirota, Snyder, Soper, Sullivan, Tipper, Titone, Valdez A, Valdez D, Van Bever, Van Winkle, Weissman, Will, Williams, Woodrow, Woog, Young, and Mr. Speaker.
With 56 present, 9 excused, we have a quorum. Representative Basenecker.
Mr. Speaker, I move that the Journal of Thursday, May 6, 2021 be approved as corrected by the Chief Clerk.
Well, members, you've heard the motion that the journal be approved as corrected by the Chief Clerk. All those in favor say aye.
Aye.
Uh-oh. All those opposed say no. I must say, in my 7 years here, that was the loudest no vote I have ever heard. But the ayes have it, and the motion is adopted. Majority Leader Escar.
Thank you, Mr. Speaker. I move that we proceed out of order for continuation of general orders, second reading of bills.
You have heard the motion. Seeing no objection, we will proceed. Seeing no objection, we will proceed out of order for continuation of general order, second reading of bills. Representative Kipp. Members, you have clearly heard the motion. Seeing no objection, Representative Kipp will take the chair.
The committee will come to order. With your unanimous consent, the bills will be read by title unless there is a request for reading a bill at length. Committee reports are printed and in your bill folders. Floor amendments will be shown on the screen and on your iPads. Bills will be laid over upon motion of the majority leader. The court rule is relaxed. Mr. Gregorio, can you please read the title of HB 21-1232?
House Bill 1232 by Representatives Roberts and Judah, also Senator Donovan, concerning the establishment of a standardized health benefit plan to be offered in Colorado.
Is there any further discussion on HB 21-1232? On the health and insurance report? Are we done? Okay. We're done with the health. We're done with the report. The committee report. Any further discussion on the committee report for HB 21-1232? Okay, seeing none, all in favor say aye. Aye. All opposed say no. It passes. The committee report is adopted. On to the bill. Monsieur Sopin.
Merci, Madam Chair. I appreciate that. So now that we're on to the bill, I just want to add a little bit to what I didn't say on Thursday, now that we're here on Friday. One thing that we've heard from a lot of businesses who are self-funded plans is that any business over 50 employees actually sees a benefit from being self-insured. The bill, aside from a study element, doesn't address the costs and cost shifting that is likely to occur to these self-funded plans. Businesses actually see a benefit by being self-insured. First of all, they can write the plans with the employees to be able to focus on the health of the covered lives. They're able to focus on lowering the cost of health care by asking for generics, creating incentives for healthy lifestyles. Then there's secondary benefits, or secondary businesses that receive a benefit of those self-funded plans. Those would be people like gyms or health coaches, in which there was a benefit seen from that within the plan. And then, of course, access to primary care. I'm also concerned about access to care for patients who are on Medicaid or Medicare. So by requiring the standardized plan, and doctors take the standardized plan, what ends up happening is there's no requirement for Medicaid or Medicare. So it's very easy to say, if you're a primary care physician or a hospital, I'm only going to accept Medicaid patients on Friday, or every other Friday, or one day a month, or maybe even not at all. In which case, those who are in poverty amongst us would be denied access to the health care they absolutely need in favor of the standardized plans. Same would be true for Medicaid or Medicare patients who would be our seniors. This ought to be a concern of everyone in this chamber. I'm not going to repeat the words that I said on Thursday, now that we're here on Friday. But I do just want to continue to point out that there continues to be flaws with this bill and that I would ask members to really think about the bill as a whole and all the different elements, because it's in the minutia that we need to be paying attention to this bill. I doubt there's a member amongst us who wants to see higher insurance premiums. I don't. It's for sure. I think we need lower insurance premiums. But how we get there, reducing access to care, is something we all should be thinking about as we take a vote. So with that, members, I ask for a no vote on House Bill 1232. Thank you.
Thank you, Representative Sapir. Is there any further discussion on HB 21-1232? Okay, Representative Hanks.
Thank you, Madam Chair. I had a couple of reference points here I wanted to read to you. It is, I don't know if anybody's familiar with Sally Pipes from the Pacific Research Institute, but wrote an interesting book. It's 55 pages. I'm jumping to the conclusion of it. It pertains to what we're doing here. And it says, conclusion. Single-payer may provide universal coverage, but as the single-payer systems in Canada, the United Kingdom, and the United States prove, a person who has coverage doesn't necessarily have access to care. A year-long wait for treatment from a Canadian specialist doesn't constitute access. As recently retired Chief Justice Beverly McLachlin of Canada's Supreme Court wrote in a 2005 decision overturning Quebec's ban on private health insurance, access to a waiting list is not access to health care. The millions of Britons languishing on wait lists would surely agree. So would the thousands of American seniors on Medicare and low-income patients on Medicaid who can't find a doctor. And that's why this comment and this conclusion pertains to what we're talking about here, is the very real threat that hospitals are going to close as a result of this. The U.S. healthcare system needs reforming, Sally Pipes continues. To improve access, our nation must therefore focus on making care more affordable without sacrificing the high quality that it sets the American system apart. Single payer fails that test. Free coverage may appear affordable to patients, but it's proven unaffordable for governments and the taxpayers that fund them. Government officials have responded by simply capping supply, that is, limiting access to care. That goes back to my comments on by Thomas Sowell that can either reduce the quantity or the quality, but can't change the cost of it. Such rationing, Sally Pipes continues, may be direct, like waiting lists or refusals to cover expensive drugs, or it may be indirect in the form of cut rate payments to healthcare providers that cause them to work fewer hours or close up shop altogether. That's our fear here in Colorado, I would say, at least on my side of the aisle. Americans want affordable, accessible, quality health care. Single payer offers just the opposite. That's the unfortunate and true promise of, in this case, Medicare
Excuse
for
me,
all.
Representative Hanks, we aren't talking about single payer. Could you please talk about the Colorado option? Thank you.
Well, it all kind of leads to the same thing. There's another element in here about, this actually has some local names in it, and this also is brief. And when you watch Colorado's behavior, you really don't have to go much beyond California or Washington, D.C. And so it is germane to what we're talking about here. And I've got a brief comment that by about the fourth paragraph will start to become clear. Medicare for all might be the most brazen attempt at a single payer and the most unrealistic. And referring to Bernie Sanders in this case, bear with me.
Representative Hanks, we really are not talking about Medicare for all or single payer. If you could please
say
talk
again?
about the bill.
Well, you know, actually I think we are, but Madam Chair, I ask that the bill be read at length. Thank you.
First regular session, 73rd General Assembly, State of Colorado, introduced. LLS No. 21-0050.02 Kristen Forrestal X 4217 House Bill 21 to 1232. 21 to 1232. House Committees, Senate Committees, Health and Insurance. A bill for an act. 101 concerning the establishment of a standardized health. 102 benefit plan to be offered in Colorado. Bill summary. Note, this summary applies to this bill as introduced and does not reflect any amendments that may be subsequently adopted. If this bill passes third reading in the House of Introduction, a bill summary that applies to the re-engrossed version of this bill will be available at http://leg.colorado.government. The bill requires the Commissioner of Insurance, Commissioner, in the Department of Regulatory Agencies to establish a standardized health benefit plan, by rule to be offered by health insurance carriers, in the individual and small group markets. The standardized plan must offer healthcare coverage at the bronze, silver, and gold. House sponsorship: Roberts and Jode, Mullica, Amabile, Burnett, Caravio, Cutter, Duran, Gonzalez, Gutierrez, Hooten, Kennedy, Kipp, McCluskey, McCormick, Ortiz, Ricks, Sirota, Tipper, Valdez A, Weissman, Woodrow. Senate sponsorship: Donovan, Bridges, Danielson, Gonzalez, Jacquez Lewis, Peterson, Story, Winter. Shading denotes House amendment. Double underlining denotes Senate amendment. Capital letters or bold and italic numbers indicate new material to be added to existing statute. Dashes through the words indicate deletions from existing statute. Levels. Be offered through the Colorado Health Benefit Exchange. Be a standardized benefit design created through a stakeholder engagement process. Provide first dollar, predictable coverage for certain high-value services, and comply with state and federal law. Beginning January 1st, 2023, and each year thereafter, the bill encourages carriers that offer an individual health benefit plan in Colorado to offer the standardized plan in the individual market, and a small group health benefit plan in Colorado to offer the standardized plan in the small group market. For 2023, each carrier shall set a goal of offering a standardized plan premium that is at least 10% less than the premium rate for health benefit plans offered by that carrier in the 2021 calendar year in the individual and small group market. For 2024, each carrier shall set a goal of offering a standardized plan premium that is at least 20% less than the premium rate for health benefit plans offered by that carrier in the 2021 calendar year in the individual and small group market. For 2025 and each year thereafter, carriers are encouraged to limit annual premium rate increases for the standardized plan to no more than the Consumer Price Index plus 1% relative to the previous year. The Colorado Option Authority is created for the purpose of operating as a carrier to offer the standardized plan as the Colorado option if the carriers do not meet the established premium rate goals. The authority shall operate as a nonprofit, unincorporated public entity. The authority is required to implement a provider fee schedule as established by the Commissioner in consultation with the Executive Director of the Department of Healthcare Policy and Financing. Healthcare providers and health facilities are required to accept consumers who are enrolled in any health benefit plan offered by the authority. The bill creates an advisory committee to make recommendations to the authority concerning the development, implementation, and operation of the authority. The Commissioner is required to apply to the Secretary of the United States Department of Health and Human Services for a waiver and include a request for a pass-through of federal funding to capture savings as a result of the implementation of the standardized plan. The Commissioner is required to disapprove of a rate filing submitted by a carrier if the rate filing reflects a cost shift between the standardized plan and the health benefit plan for which rate approval is being sought. The bill makes the failure to accept consumers who are covered through the Colorado option or the balance billing of a patient in violation. -2 HB 21-1232. Of this bill grounds for discipline under specified practice acts. The bill repeals the authority and its functions if the United States Congress establishes a national public option program that meets or exceeds the premium rate goals set forth in healthcare coverage pursuant to this bill. 1. Be it enacted by the General Assembly of the State of Colorado. 2. Section 1. In Colorado Revised Statutes, add Part 13 to Article 316 of Title 10 as follows. 4. Part 13-5 Colorado Option Health Benefit Plan 6 October 16, 1301. Short title. The short title of this Part 13 is the 7 Colorado Option Health Benefit Plan Act. 8 October 16, 1302. Legislative Declaration, Intent. 1. The General 9 Assembly, through the exercise of its police powers to protect 10 the health, peace, safety, and general welfare of the people of 11 Colorado, hereby finds that 12a. Health insurance coverage has been demonstrated to 13 have a positive impact on people's health outcomes as well as 14 their financial security and well-being. 15b. Ensuring that all people have access to affordable, 16 quality, continuous, and equitable health care is a challenge. 17 that public officials and policy experts have faced for decades. 18 despite seemingly constant efforts to address the issue. 19. C. Although great strides have been made in increasing 20. Access to health care coverage through federal and state 21 legislation, not enough has been accomplished to address the 22 affordability of health insurance in Colorado, particularly in 23 the state's rural areas and for groups historically in -3 HB 21-1232. 1. Systematically disinvested in public policy including people of two color and undocumented Coloradans. 3. D. The healthcare system is a complex system wherein 4 consumers rely on health insurance carriers to negotiate the 5 rates paid to healthcare providers, pharmaceutical companies, 6. In hospitals for services provided to consumers and expect 7. That the negotiated rates are closely tied to the amount of the 8 health insurance premiums paid by consumers. 9. E. Despite efforts to address access to and affordability. 10. Of health care, underlying health care costs continue to rise. 11. Thus driving up the costs of health insurance premiums, often at 12 disproportionate rates in rural areas of the state. 13. F. In order to ensure that health insurance is affordable. 14. For Coloradans, it is critical that the state establish a 15 standardized plan for carriers to offer in the state and to set 16 premium targets for carriers to achieve. And 17. G. If carriers cannot offer the standardized plan at the 18 premium targets set forth in this Part 13, a quasi-governmental 19 entity is needed to offer the Colorado option, an affordable 20 healthcare option, for the purpose of increasing equitable 21 access to and availability of statewide affordable, quality 22 health insurance in the small group market and to any resident 23 seeking coverage in the individual market. 24 October 16, 1303. Definitions. As used in this Part 13, unless the 25 context otherwise requires. 26. 1. Advisory Committee means the Colorado Option 27 Advisory Committee established in Section October 16, 1308. 4 HB 21-1232. 1. 2. Authority means the Colorado Option Authority 2 described in Section October 16, 1306. 3. 3. Board means the Colorado Option Authority Board 4 described in Section October 16, 1306. 5. 4. Colorado option means a standardized plan offered 6 by the authority. 7. 5. Healthcare coverage cooperative has the same 8 meaning as set forth in Section October 16, 1002. 2. 9. 6. Healthcare provider means a healthcare 10 professional registered, certified, or licensed pursuant to Title 1112 or a health facility licensed pursuant to Section 25-1.5-103. 12. 7. Public Benefit Corporation means a public benefit 13 corporation formed pursuant to Part 5 of Article 101 of Title 714 that may be organized and operated by the exchange pursuant 15 to Section 10-22-106. 3. 16. 8. Small group market means the market for small 17 group sickness and accident insurance. 18. 9. Standardized plan means the standardized health. 19. Benefit plan designed by rule of the Commissioner pursuant to 20 Section October 16, 1304. 21 October 16, 1304. Standardized Health Benefit Plan, established. 22 Rules. 1. On or before January 1, 2022, the Commissioner shall 23 establish, by rule, a standardized health benefit plan to be 24 offered by carriers in this state in the individual and small 25 group markets. The standardized plan must, 26, A, offer healthcare coverage at the bronze, silver, and 27 gold levels of coverage as described in Section 10-16-103.4. 5 HB 21-1232. 1. B. Include, at a minimum, all essential health benefits. 2. C. Be offered through the exchange and through the 3 public benefit corporation, if any. 4. D. Be a standardized benefit design that. 5. Is created through a stakeholder engagement process. 6. That includes healthcare industry and consumer. 7. Representatives and individuals working in or representing 8 communities that are diverse with regard to race, ethnicity. 9. Immigration status, age, ability, sexual orientation, gender. 10. Identity, or geographic regions of the state or are affected by 11. Higher rates of health disparities and inequities. 12. 2. Has a defined benefit design and cost sharing. And 13. 3. Is designed to improve racial health equity and 14. Decrease racial health disparities, through a variety of means. 15. Including the improvement of perinatal health care coverage. 16. E. Provide first dollar, pre-deductible coverage for 17 certain high-value services identified collaboratively with 18 consumer stakeholders that reduce racial disparities in health. 19. Outcomes, such as primary health care and behavioral health. 20. Care, and 21. F. Comply with the Federal Act and this Article 16. 22. 2. The standardized plan must be offered in a manner 23 that allows consumers to easily compare the standardized 24 plans offered by each carrier. 25. 3. The Commissioner may update the standardized plan 26 annually by rule through the stakeholder process set forth in 27 subsection 1 D I of this section. 6 HB 21-1232. 1 October 16, 1305. Standardized Health Benefit Plan, Carriers 2 required to offer, required components, Commissioner, Rules. 3. 1. Beginning January 1, 2023, and each year thereafter, A4 carrier that offers. 5. A. An individual health benefit plan in Colorado. Is 6 encouraged to offer the standardized plan in the individual 7 market in each zip code where the carrier offers an individual 8 health benefit plan. And 9. B. A small group health benefit plan in Colorado. Is 10 encouraged to offer the standardized plan in the small group 11 market in each zip code where the carrier offers a small group 12 health benefit plan. 13, 2A, I, in the individual market, for the plan year 14 beginning January 1st, 2023, and in the small group market, 15 beginning January 1st, 2023, each carrier that offers the 16 standardized plan shall set a goal of offering the standardized 17 plan at a premium rate that is at least 10% less than the 18 premium rate for health benefit plans that the carrier offered. 19 in the 2021 calendar year in the individual and small group 20 markets. The Commissioner must calculate the premium rate 21 reduction based on the rates charged in the same county in 22 which the carrier offered health benefit plans in the individual 23 and small group markets in 2021 prior to the application of the 24 Colorado Reinsurance Program pursuant to Part 11 of this 25 Article 16. 26, 2, for carriers offering the standardized plan in a 27 county in which the carrier did not offer a health benefit plan. 7 HB 21-1232. 1 in the individual or small group market in 2021, each carrier 2 that offers the standardized plan shall set a goal of offering 3 the standardized plan. 4A, in the individual market at a premium rate that is at 5 least 10% less than the average premium rate for 6 individual plans offered in that county in 2021, calculated 7 based on the average premium rate for individual health benefit 8 plans offered in that county prior to the application of the 9 Colorado Reinsurance Program pursuant to Part 11 of this 10 Article 16, and 11B, in the small group market at a premium rate that is at 12 least 10% less than the average premium rate for small 13 group plans offered in that county in 2021, calculated based on 14 the average premium rate for small group plans offered in that 15 county prior to the application of the Colorado Reinsurance 16 program pursuant to Part 11 of this Article 16. 17B, I, in the individual market, for the plan year 18 beginning January 1st, 2024, and in the small group market 19 beginning January 1st, 2024, each carrier that offers the 20 standardized plan shall set a goal of offering the standardized 21 plan at a premium rate that is at least 20% less than 22 the premium rate for health benefit plans that the carrier 23 offered in the 2021 calendar year in the individual and small 24 group markets. The Commissioner must calculate the premium 25 rate reduction based on the rates charged in the same county in 26 which the carrier offered health benefit plans in the individual 27 and small group markets in 2021 prior to the application of the 8 HB 21-1232. 1 Colorado Reinsurance Program pursuant to Part 11 of this 2 Article 16. 3, 2, for carriers offering the standardized plan in a 4 county in which the carrier did not offer a health benefit plan 5 in the individual or small group market in 2021, each carrier 6 that offers the standardized plan shall set a goal of offering 7 the standardized plan. 8A, in the individual market at a premium rate that is at 9 least 20% less than the average premium rate for 10 individual plans offered in that county in 2021, calculated 11 based on the average premium rate for individual plans offered 12 in that county prior to the application of the Colorado 13 Reinsurance Program pursuant to Part 11 of this Article 16. And 14B, in the small group market at a premium rate that is at 15 least 20% less than the average premium rate for 16 small group plans offered in that county in 2021, calculated 17 based on the average premium rate for small group plans. 18 offered in that county prior to the application of the Colorado 19 Reinsurance Program pursuant to Part 11 of this Article 16. 20C, for the plan year beginning January 1st, 2025, and each 21 year thereafter, each carrier and healthcare coverage 22 cooperative is encouraged to limit annual premium rate 23 increases for the standardized plan in both the individual and 24 small group markets by a rate that is no more than the maximum 25 of the Consumer Price Index for all urban consumers plus 126% relative to the previous year. 27, 3, the premium rate reductions in subsections 2A and -9 HB 21-1232. 1, 2B, of this section for the standardized plan offered in the 2 individual and small group markets must account for Policy 3 adjustments deemed necessary to prevent people with low and 4 moderate income from experiencing net increases in premium 5 costs. 6 October 16, 1306. Colorado Option Authority, Creation, Board of 7 Directors, Powers and Duties, Rules. 1A, there is hereby established a nonprofit, unincorporated public entity known as 9 the Colorado Option Authority. Implementation and operation 10 of the authority is contingent upon approval of a waiver 11 submitted by the Commissioner in accordance with Section 12 October 16, 1309 and the receipt of any federal funds. 13B, I, the purpose of the authority is to operate as a 14 carrier in this state and offer the Colorado option to 15 individuals and small employers statewide if an independent. 16 actuarial analysis demonstrates that all carriers failed to 17 meet the premium rate goals specified in Section October 16, 13054. 18 2023 and 2024 as adjusted for changes to the standardized plan 19 based on changes in plan coverage requirements imposed under 20 state or federal law. The actuarial analysis must take into 21 account any changes to the standardized plan offered in 2023, 22 and 2024 and state or federal health benefit coverage mandates 23 implemented in 2023 or 2024. The Commissioner shall establish, by 24 rule, the requirements for the methodology to calculate 25 premium rate reductions. 26. 2. If the Commissioner determines that all carriers 27 failed to meet the premium goals specified in Section October 16, 1305. 10 HB 21-1232. 1. The Commissioner shall notify the Governor and the Board that 2. The authority is required to offer the Colorado option pursuant 3 to this Part 13. 4. C. The authority is an instrumentality of the state. 5. Except that the debts and liabilities of the authority do not 6. Constitute the debts and liabilities of the state, and the 7. Authority is not an agency of the state. The authority is not a 8 district for purposes of Section 20 of Article X of the State 9 Constitution. The authority is not authorized to promulgate 10 rules pursuant to the State Administrative Procedure Act, 11 Article 4 of Title 24. 12. D. The authority shall implement the Provider 13 reimbursement fee schedule established in Section October 16, 1307 for 14 services covered by the Colorado option. 15. 2. A. The Colorado Option Authority Board is hereby 16 created. The board consists of 9 members appointed by the 17 Governor and confirmed by the Senate. The board is the 18 governing body of the authority and shall determine the 19 development, governance, and operation of the authority. The 20 board is not an agency of the state. 21. B. I. In making appointments to the board, the Governor 22 shall appoint individuals who have experience or expertise in at 23 least 2 of the following areas. 24. A. Individual health insurance coverage. 25. B. Value-based purchasing and plan design. 26. C. Healthcare consumer navigation and assistance in 27. Accessing healthcare. 11 HB 21-1232. 1. D. Healthcare finance. 2. E. The provision of healthcare services in rural areas. 3. F. The provision of healthcare services to uninsured and for low-income populations. 5. G. Healthcare actuarial analysis. 6. H. As a member of an employee organization that 7. Represents employees in the healthcare industry. 8. I. Healthcare delivery systems. 9. J. Representing consumers in the development of 10. Healthcare policy. 11. K. Hospital administration. 12. L. Insurance brokerage. N. 13. M. Improving health equity for communities of color, and 14. Decreasing racial disparities in health care. 15. 2. The Governor must ensure that the membership of the 16 Board, as a whole, has demonstrated experience and expertise in 17 most areas outlined in subsection 2, B, I, of this section. 18. 3. At least 5 members of the Board must be 19 consumers, representatives of consumers, and small business 20 owners. 1 member must be a representative of hospitals. 1. 21 member must be a representative of providers. 22. 4. To the extent possible, the Governor shall appoint 23 board members who reflect the diversity of the state with 24 regard to race, ethnicity, immigration status, income, wealth, 25 ability, and geographic in considering geographic diversity. The 26 Governor shall attempt to appoint members from both rural and 27 urban areas of the state. 12 HB 21-1232. 1. V. A person who is employed by a carrier or a managed to-care organization is not eligible for appointment to the board. 3. C. The Governor shall appoint 5 members to an initial 4 term of 4 years and 4 members to an initial term of 5 years. Thereafter, the term of office of all members is for 6 years. Each member may serve no more than 2 full 4-year 7 terms. Members who serve an initial 2-year term may serve up 8 to 2 additional 4-year terms after serving the initial 9 term. 10. D. Members of the board serve at the pleasure of the 11 Governor. The Governor may appoint new members to fill any 12 vacancies on the board in accordance with subsections 2, B, and 13, 2, C, of this section. 14. E. The members must publicly disclose whether they have 15 any financial interest in the implementation of the Colorado 16 option. 17. F. Members of the board may receive a per diem for their 18 service on the board and may be reimbursed for actual and 19 necessary expenses, including any required dependent care and 20 dependent or attendant travel, food, and lodging, while 21 engaged in the performance of official duties of the board. 22. G. The Governor shall convene the board and provide 23 technical and administrative support to assist with the board's 24 organizational duties. The board shall elect a chair and 25 vice chair from among the appointed members. The board shall 26 meet as often as necessary to carry out its duties pursuant to 27 this section. 13 HB 21-1232. 1. H. The board and its members, 2. I, are subject to Part 4 of Article 6 of Title 24 and Part 2-3 of Article 72 of Title 24, except that members of the board may convene in groups of no more than 3 members to organize 5 and plan for the business of the authority as long as no formal 6 action is taken that concerns the business of the authority. 7. 2. Are not required to comply with the Procurement 8 Code, Articles 101 to 112 of Title 24, and 9. 3. Are not subject to or part of the State Personnel 10 System, Article 50 of Title 24. 11. 3. The board shall, 12. A. Hire an executive director of the authority. 13. B. Seek and maintain, on behalf of the authority, a 14 certificate of authority to do business pursuant to Section 1510-3-105 to enable the authority to operate as a carrier in this 16 state. 17. C. Consult with and consider recommendations of the 18 Advisory Committee created in Section October 16, 1308, N. 19. D. Not duplicate or replace the powers and duties of the 20 Commissioner pursuant to this Article 16. 21. 4. The Board, on behalf of the authority, may contract 22 with state agencies in order to implement the Colorado option. 23 October 16, 1307. Provider fee schedule, duty of Commissioner, 24 healthcare providers, rules. 1. The Commissioner shall 25 promulgate rules to establish a reasonable reimbursement fee 26 schedule for healthcare services that are covered by the 27 Colorado option. The Commissioner shall consult with the 14 HB 21-1232. 1. Executive Director of the Department of Healthcare Policy and 2. Financing to inform healthcare providers concerning the 3 proposed fee schedule. The Commissioner shall make the fee 4 schedule available to the authority to enable the authority to 5 set premium rates for the Colorado option. The premium rates 6 are subject to review and approval pursuant to Section 710-16-107. 8b. In establishing the reimbursement fee schedule, the 9 Commissioner may take into account the circumstances of 10 critical access hospitals, rural and independent healthcare 11 providers, and those healthcare providers that serve a 12% of uninsured patients and patients who receive 13 medical services through the Colorado Medical Assistance 14 Act, Articles 4 to 6 of Title 25.5, that exceeds the statewide 15 average and may consider the cost of adequate wages, benefits. 16. Staffing and training for healthcare providers employees to 17. Provide adequate care. 18. C. The fee schedule established pursuant to this. 19. Subsection 1. Must. 20. Apply to hospitals, healthcare providers, pharmacies, 21 and all other providers delivering healthcare services in 22 Colorado that are covered by the Colorado option. 23. 2. Set the reimbursement fees for 2025 to achieve at 24 least a 20% premium reduction when compared to the 25 rates for health benefit plans offered by carriers in the 26 individual and small group markets in 2021. 27. 3. Set reimbursement fees for 2026 and each year. 15 HB 21-1232. 1. Thereafter at rates that ensure that the Colorado Option 2 premiums do not increase by more than the Consumer Price Index 3 for all urban consumers plus 1% relative to the 4 previous year, and 4. Be available to other health plans as determined by 6. The Commissioner, including healthcare coverage cooperative 7 if members of the cooperative opt to be subject to the 8 regulatory authority of the Commissioner. 9. 2. Each healthcare provider shall accept patients who 10 are enrolled in any Colorado option plan offered by the 11 authority, except that the Commissioner may, in consultation 12 with the Department of Healthcare Policy and Financing and the 13 Board, exempt a particular healthcare provider, hospital, or 14 pharmacy from the fee schedule or change the fee schedule for 15 that entity upon a demonstration that the fee schedule will 16 reduce the entity's ability to accept or provide healthcare. 17. Services to patients who are uninsured or enrolled in a program. 18. Of medical assistance established pursuant to Section 25.5-4-10419 or the Children's Basic Health Plan established pursuant to 20 Article 8 of Title 25.5. 21. 3. A healthcare provider in Colorado shall not balance 22 bill consumers enrolled in the Colorado option and shall 23 accept the fee specified in the fee schedule established by the 24 Commissioner pursuant to subsection 1 of this section for the 25 service provided to the consumer. 26. 4. When implementing the hospital reimbursement rate 27 formula pursuant to this section, the Commissioner shall, in 16 HB 21-1232. 1. Collaboration with the Board, consult with employee 2 membership organizations representing healthcare providers 3 employees in Colorado and with hospital-based healthcare 4 providers in Colorado and, based on the consultations, may 5 make changes, by rule, to the hospital reimbursement rate 6 formula as appropriate so that reimbursement rates reflect the 7 cost of adequate wages, benefits, staffing, and training for 8 these employees to provide quality care. 9 October 16, 1308. Advisory Committee, Creation, Purpose. 1. The 10 Board shall appoint an advisory committee to make 11 recommendations to the Board and the authority concerning 12 the development, implementation, and operation of the 13 authority and the Colorado option.in making recommendations 14 to the authority and the Board. The advisory committee shall 15 give special consideration to Coloradans with low income and 16 to communities of color. 17. 2. The Board shall determine the terms for the advisory. 18 committee members and shall ensure that the advisory. 19 committee represents the diversity of the state. The Advisory 20 Committee must include members who intend to enroll in the 21 Colorado option. 22 October 16, 1309. Commissioner, waiver. 1. On or after the 23 effective date of this section, the Commissioner may apply to the 24 Secretary of the United States Department of Health and Human 25 Services for a state innovation waiver to waive 1 or more 26 requirements of the Federal Act as authorized by Section 1332 of 27 the Federal Act to capture all applicable savings to the Federal. 17 HB 21-1232. 1. Government as a result of the implementation of this Part 13. 2. Upon approval of the 1,332 waiver application, the 3 Commissioner may use any federal money received through the 4 waiver. 5. A. For the establishment of the authority for the purpose 6 of offering the Colorado option, and 7. B. For the Colorado Health Insurance Affordability 8 enterprise created in Section October 16, 1204 to increase the value, 9 affordability, quality, and equity of healthcare coverage for 10 all Coloradans, with a focus on increasing the value, 11 affordability, quality, and equity of health care coverage for 12 Coloradans historically and systematically disadvantaged by 13 health and economic systems. 14. 3. The implementation and operation of the Authority IS-15 contingent upon approval of the 1,332 waiver application and the 16 receipt of any federal funds. 17 October 16, 1310. Rules. The Commissioner may promulgate Rules 18 as necessary to develop, implement, and operate this Part 13. 19 October 16, 1311. Severability. If any provision of this Part 13 or 20 application thereof to any person or circumstance is judged 21 invalid, the invalidity does not affect provisions or applications 22 of this Part 13 that can be given effect without the invalid 23 provision or application, and to this end the provisions of this 24 Part 13 are declared severable. 25 October 16, 1312. Repeal if National Public Option Program enacted. 26. The provisions of this Part 13, except for Sections 1016 to 1303, 8, 27 and 9, October 16, 1304, and October 16, 1305, 1, will be repealed if, after -18 HB 21-1232. 1. The effective date of this Part 13, the United States Congress 2 enacts, and the President signs a National Public Option Program 3 that meets or exceeds the premium reduction goals set forth in 4 Section October 16, 1305, 2, and covers the population that will 5 receive coverage under this Part 13. The Commissioner shall 6 notify the reviser of statutes in writing of the date on which the 7 conditions specified in this section has occurred by emailing the 8 notice to revisorofstatutes.ga@state.co.us. The provisions of 9 this Part 13, except for Sections October 16, 1303, 8, and 9, October 16, 1304, 10, and October 16, 1305, 1, are repealed, effective upon the date 11 identified in the notice that the condition specified in this 12th section has occurred, or, if the notice does not specify that date, 13 upon the date of the notice to the reviser of statutes. 14. Section 2. In Colorado Revised Statutes, 10-16-107, amend 15, 3A, V, and add 3A, 7, as follows. 1610-16-107. Rate filing regulation, benefits ratio, rules. 17. 3A. The Commissioner shall disapprove the requested rate increase if 18 any of the following apply. 19. B. The rate filing is incomplete. Or 27. The rate filing reflects a cost shift between the 21 standardized plan, as defined in Section 10-16-1303, 9, offered by 22 the carrier and the health benefit plan for which rate approval 23 is being sought. The Commissioner may consider the total cost of 24 health care in making this determination. 25. Section 3. In Colorado Revised Statutes, October 16, 1206, amend 26, 1D and 1E and add 1F as follows. 27 October 16, 1206. Health Insurance Affordability Cash Fund. -19 HB 21-1232. 1. Creation. 1. There is hereby created in the State Treasury the Health 2 Insurance Affordability Cash Fund. The fund consists of 3D. The revenue collected from revenue bonds issued pursuant to 4 Section October 16, 1204, 1B, 2, and 5E. All interest and income derived from the deposit, and 6 investment of money in the fund, money allocated to the fund 7 pursuant to Section October 16, 1309, and 8F. All interest and income derived from the deposit, and 9 investment of money in the fund. 10 Section 4. In Colorado Revised Statutes, 10-22-106, amend 11, 1, introductory portion, 1J and 1K, and add 1L as follows. 12-10-22-106. Powers and duties of the Board. 1. The Board is the 13 governing body of the exchange and has all the powers and duties 14 necessary to implement this article. Article 22. The Board shall, 15J, consider the affordability and cost in the context of quality 16 care and increased access to purchasing health insurance, and 17K, investigate requirements, develop options, and determine 18 waivers, if appropriate, to ensure that the best interests of Coloradans are 19 protected, and 20L, conduct a survey, through the exchange, of consumers 21 who purchased the standardized health benefit plan developed 22 pursuant to Section October 16, 1305, which survey addresses the 23 consumers' purchasing experience, generally, and whether the 24 standardized plan addresses health equity and health disparity. 25 issues. 26 Section 5. In Colorado Revised Statutes, 12-200-109, amend 27, 1N, and 1O, and add P, as follows. -20 HB 21-1232. 112-200-109. Grounds for disciplinary action. 1. The Director may second deny licensure to or take disciplinary action against an acupuncturist 3 pursuant to Sections 12-20-403, 12-20-404, and 24-4-105 if the Director 4 finds that the acupuncturist has committed any of the following acts. 5. N. Committed and been convicted of a felony or entered a plea of 6 guilty or nolo contendere to a felony, and 7. O. Published or circulated, directly or indirectly, any fraudulent, 8 false, deceitful, or misleading claims or statements relating to 9. Acupuncture or to the acupuncturist's practice, capabilities, services, 10 methods, or qualifications, and 11. P. Failed to comply with Section October 16, 1307, 2, or 3. 12. Section 6. In Colorado Revised Statutes, 12-215-115, add 13, 1, FF, as follows, 1412-215-115. Discipline of licensees, suspension, revocation, 15 denial, and probation, grounds, definitions. 1. Upon any of the 16 following grounds, the board may take disciplinary or other action as 17 specified in Section 12-20-404 or impose conditions on a licensee's 18 license. 19. FF, failing to comply with Section October 16, 1307, 2, or 3. 20. Section 7. In Colorado Revised Statutes, 12-225-109, add 21, 3, 0, as follows, 2212-225-109. Disciplinary action authorized, grounds for 23 discipline, injunctions, rules. 3. The director may take disciplinary 24 action as authorized by Section 12-20-404, 1A, 1B, or 1D, for any 25 of the following acts or omissions. 26. 0. Failing to comply with Section October 16, 1307, 2, or 3. 27. Section 8. In Colorado Revised Statutes, 12-235-111, amend. -21 HB 21-1232. 1 P and at 1 R as follows. 212-235-111. Grounds for discipline, definitions. 1. The 3 director is authorized to take disciplinary action pursuant to Section 412-235-112 against any person who has 5. P. Used fraudulent, coercive, or dishonest practices, or 6. Demonstrated incompetence or untrustworthiness, in this state or 7 elsewhere, or 8. R. Failed to comply with Section October 16, 1307, 2, or 3. 9. Section 9. In Colorado Revised Statutes, 12-240-121, add 10, 1, HH, as follows, 1112-240-121. Unprofessional conduct, definitions. 12. 1. Unprofessional conduct as used in this Article 240 means. 13. HH. Failing to comply with Section October 16, 1307, 2, or 3. 14. Section 10. In Colorado Revised Statutes, 12-245-224, amend 15, 1, W, and 1, X, and add 1, Y, as follows. 1612-245-224. Prohibited activities, related provisions. 17. Definition. 1. A person licensed, registered, or certified under this 18 Article 245 violates this Article 245 if the person 19. W. Has sold or fraudulently obtained or furnished a license. 20. Registration, or certification to practice as a psychologist, social worker. 21. Marriage and family therapist, licensed professional counselor. 22. Psychotherapist, or addiction counselor, or has aided or abetted in those 23 activities. Or 24. X. Has failed to respond, in the manner required by the board, to 25. A complaint filed with or by the board against the licensee, registrant, or 26. Certificate holder. Or 27. Y. Has failed to comply with Section October 16, 1307, 2, or 3. 22 HB 21-1232. 1. Section 11. In Colorado Revised Statutes, 12-255-120, amend 2, 1, GG, and add 1, 2, as follows. 312-255-120. Grounds for discipline, definitions. 1. Grounds for discipline, as used in this Part 1, means any action by any person 5 who, 6, GG, is diverting or has diverted a controlled substance, as defined 7 in Section 18-18-102, 5, or any other drug having similar effects from the 8 person's place of employment, or 9, 2, fails to comply with Section October 16, 1307, 2, or 3. 10. Section 12. In Colorado Revised Statutes, 12-270-114, amend 11 as enacted by Senate Bill 21-003, 2, O, and 2, P, and add 2, Q, as 12 follows. 13-12-270-114. Grounds for discipline, disciplinary proceedings. 14. Definitions, judicial review. 2. The director may take disciplinary or 15 other action as authorized in Section 12-20-404 against, or issue a 16 cease and desist order under the circumstances and in accordance with. 17. The procedures specified in Section 12-20-4052, a licensee in accordance. 18. With this section, upon proof that the licensee, 19, O, has committed a fraudulent insurance act, as described in 20 Section 10-1-128, or 21, P, has otherwise violated this Article 270 or any lawful order or 22 rule of the director, or 23, Q, has failed to comply with Section October 16, 1307, 2, or 3. 24. Section 13. In Colorado Revised Statutes, 12-275-120, add 25, 1, 2, as follows. 26. 12-275-120. Unprofessional conduct, definitions. 1. The term 27 unprofessional conduct, as used in this Article 275, means Dash 23 HB 21-1232. 1, 2. Failing to comply with Section October 16, 1307, 2, or 3. 2. Section 14. In Colorado Revised Statutes 12-285-120, add 3, 1, AA, as follows: 412-285-120. Grounds for disciplinary action, definitions. 5. 1. The board may take disciplinary action in accordance with Sections 612-20-404 and 12-285-122 against a person who has 7. AA. Failed to comply with Section October 16, 1307, 2, or 3. 8. Section 15. In Colorado Revised Statutes 12-290-108, add 9, 3, Z, as follows: 1012-290-108. Issuance, revocation, or suspension of license. 11. Probation, unprofessional conduct, definitions, immunity in 12. Professional review. 3. Unprofessional conduct as used in this Article 13-290 means 14. Z. Failing to comply with Section October 16, 1307, 2, or 3. 15. Section 16. In Colorado Revised Statutes, add 25-3-126 as 16 follows: 1725-3-126. Health facilities, Colorado option, covered persons 18, services, balance billing prohibited. 1. A health facility. 19. Licensed or certified by the department pursuant to Section 2025-1.5-103, 1, that provides services covered under the 21 Colorado option, as defined in Section October 16, 1303, 4, shall, 22a, accept consumers who are enrolled in the Colorado 23 option offered by the Colorado Option Authority described in 24 Section October 16, 1306, 25b, not balance bill consumers enrolled in a Health 26 benefit plan offered by the Colorado Option Authority, and 27c, accept the fee specified in the fee schedule established. 24 HB 21-1232. 1. Pursuant to Section October 16, 1307, 1, for services provided to a 2 consumer enrolled in the Colorado option. 3. 2. The department may suspend, revoke, or impose 4 conditions on a health facility's license or certificate of 5 authority for noncompliance with this section. 6. Section 17. Safety Clause. The General Assembly hereby finds, 7. Determines, and declares that this act is necessary for the immediate 8. Preservation of the public peace, health, or safety. 25 HB 21-1232.
Thank you. Is there any further discussion on HB 21-1232? Representative Hanks.
Thank you, Madam Chair, and thank you for the indulgence on reading that at length. There was a point to be made in that. What we just listened to, or did not listen to as the case may be, was the bill, the original bill. What we fought on all night, tried to put amendments on, was not what was read. And that's just the way it is, because we were working off an amendment to a committee report. I'm saying this mostly for the cameras, for the poor, unfortunate Colorado citizens who haven't found anything better to watch at this time of night. But here we are, and I want to make that clear. This bill, it was a mess to work with, in my opinion, and it should be voted down. The voters of Colorado should be very animated and motivated to shut this down. We fought hard for a opportunity to put it on the petition clause so that it could actually be directly voted on by the people. Didn't make it. I'm a no on this. I encourage a no vote. Thank you.
Is there any further discussion on HB 21-1232? Representative Holtorf.
Thank you, Madam Chair. I do want to express my concerns about this particular bill. We have many concerns in rural Colorado. My rural hospitals are concerned about the financial consequences that are really going to be undefined in the future as this particular legislation goes under development and plays out in the Colorado market over the next 2 or 3 years. Another concern that was brought up, but I want to express this in a little different way to the audience, is the migration of medical professionals in rural Colorado. This is a real concern as these rural hospitals, if they do begin to have financial challenges. I know that there's provisions in this for Medicaid rates meeting Medicare rates and trying to leverage and have a higher level of payout. But that also forces a greater dependence on those federal government programs. Private payers and also insurance payouts. Prices may go up to try to cover the cost of private payers, and I'm not sure about the negotiated insurance rates. So I do have some reservations and real concerns. I know that the road that this legislation has traveled has been very complicated, convoluted, and contentious. That usually is not a good thing, because that means the future of this particular legislation may be unsure and uncertain. I do have, I've done a little bit of study, not near as much study as the bill sponsors, I promise you. But I do have a book here, The High Price of Socialized Medicine. This is a history of government meddling in American health care by Dr. James W. Brooke. And there's a chapter in here, and I'm going to read this: State attempts at providing health insurance. And there's a quote in here that comes from ancient Rome. And this is from Tacitus, the Annals of Imperial Rome. It doesn't have the year. But these are not my words. These are words from the Roman Empire. It says, the more corrupt the state, the more numerous the laws. And that's the preface to this chapter. So it says here several states have had a go at health care reform recently. The Hawaii legislature tried universal health care for children. They called it Keiki Care. They did this by offering a government health insurance policy to any child up to the age of 18 who do not have one. Naturally, large numbers of parents dropped the private insurance policies that they already had for their children. They then got into the state program. Dr. Kenny Fink, administrator of the program at the Department of Human Services, said that people who were already able to afford health care began to stop paying for it so they could get it for free. And I know this isn't free health care. This is a state insurance program with a reduced premium. And I don't know if it has a zero premium base. That's a question I'd have for the bill sponsors. I don't believe that was the intent of the program, says this Dr. Fink. Once again, incentives matter more than intentions. Within a mere 7 months, the Hawaiian government had to throw in the towel. The costs were so high that they could not keep running the program. Now we turn to Massachusetts. In Massachusetts, the state legislature commanded all of their subjects to purchase health insurance under the penalty of law. I know this isn't what this bill says. Here it says, thou shalt purchase a comprehensive health insurance, thus saith the state. This was the latest fad in government schemes in an effort to make health care affordable and available to all.
Excuse me, Representative Holter, could we please talk about the Colorado option bill?
I believe I'm talking about the Colorado option bill with respect to states attempting at providing health insurance, and I believe the Colorado option bill is Colorado's plan. Am I mistaken? Well, if I am, I will not waste your time. Based on the confirmation of the bill sponsor. I just want to, I don't want to waste your time, but I do want to say that when the state does try to solve the problems of many of our financial challenges and abandon the private sector and other options, that there are historical references that show that there are problems. and not every outcome is the outcome that was perceived by the best of intentions of some of the smartest people that were attempting to promulgate and solve those problems. And I hope that that is not a journey that we are going to begin with House Bill 21-1232. Thank you.
Thank you. Is there any further discussion? Representative Larson.
Well, thank you, Madam Chair. Members, I rise in opposition to this bill. I wanted to come down and speak to the bill because indeed it has undergone a tremendous amount of changes. And I was happy to see some of the amendments that got on, brought by Representative Caraveo in particular, Keeping Children's Hospital whole, which is a place where I have and continue to be a patient my entire life. But members, I have two primary concerns with the way that this bill is crafted. First of all, I think under the new provisions and the way that we've created the price floors as well as the additional proposed benefits in the standardized plan, I'm frankly concerned that this standardized plan is going to end up costing more money than what's currently available on the market. I think that there are some corollary states that have tried similar things. Washington State comes to mind, where this may not be successful. And I worry that the framework that this bill establishes will be something that we will have to revisit several times over the next year to make adjustments in order to achieve the cost reductions that are proposed in the bill. That's one of my concerns. My second concern, and I think this is something that should concern all of us, is that this bill proposes to make Colorado a uniquely hostile state to practitioners of medicine. Under this bill, we would be the only state in the union, to my knowledge, and I am perfectly happy to be corrected if the bill sponsors have different information, but it's my understanding that we would be the only state in the union that requires doctors to take a plan. And this is important because in the ecosystem that we exist in, doctors are in tremendous demand. How often do we hear about how much of a doctor shortage there is and how high demand there is for practitioners, not just in rural areas of the state, but indeed in urban areas? And when you have that much demand and your doctors are that portable, why would they choose to locate in the one state where they have to risk their license if they decide not to take a plan, when they have 49 other states to choose to go to? So members, there are a lot of doctors that I think would just pick up and move across state lines that are currently here, not to mention doctors that are just entering medical school or graduating from medical school that are making a decision about what state they would like to locate in. I think this is going to exacerbate our crisis when it comes to primary care docs, and also something that I think we all need to be a little bit more sensitive to, which is specialty docs. Because if I am a specialist, again, and I practice in a highly specialized field, and I'm going to lean on pediatric cardiology because that's the one I have experience with, there are 2 practitioners of pediatric cardiology in an 8-state region. Both of them are in Denver right now. I was fortunate in that I got to travel an hour across town to go to my cardiology appointments every year. But every year, without fail, there was somebody in that waiting room who was there from out of state, where their parents had to get a hotel room across the street just to have an annual echocardiogram, something that I took for granted. And I don't want the kids of Colorado who have a relatively rare disorder to have to travel to another state, to have their parents have to go through taking off days of work, arranging for overnight stays, all of the disruptive things that come with that, simply because their specialist no longer wants to locate in Colorado because it's more profitable or it's more hospitable for them to locate in Texas or Utah or any of the other states around us. And that is the real danger, frankly, that I see in this bill in the immediate term, is that this is going to make us uniquely hostile to providers, and that they have very little incentive to stay in this state And under this plan, they will actively be pushed into other states. I worry that we're going to lose access to our primary care physicians. I worry that we're going to lose access to our specialists, and that the people of Colorado will pay a real price for this in quality of care that I just frankly don't think we're contemplating and we're being forthright about. So members, you know, and again, I do want to echo, I understand the issue that you are trying to address here in the bill. Could not agree more. There has indeed actually been some great work in the last few years here. Reinsurance has ended up being, frankly, far more effective than even I thought. But I think we should let some of the reforms that we have passed and the massive changes that we've done over the last 2 years take effect before we start tinkering again. So, members, I would urge a no vote, and I would ask you to really consider what this is going to do to access of care in the state.
Representative Catlin.
Thank you, Madam Chair. I'm here. I've waited all night. I wanted to talk about the bill, even though I know that the committee report was actually the bill. One of the things I wanted to talk about is that out in the country where I live, we're concerned about this. There's a lot of things that we don't know. Our rural hospitals are concerned. Doctors are calling me, they're concerned. You've heard those testimonies tonight. One of the things that's concerning me tonight is I have a community in Cortez that has a hospital, but it's very close to New Mexico and it's very close to Utah. And my question is, if a patient has the Colorado standard insurance and that hospital closes, will that insurance be accepted in New Mexico and in Utah for those constituents of mine? That's a concern to me. And as the debate's gone on, those questions are the ones that have kept bubbling to the top of my mind. I'm sure that some of the people that live out on the Eastern Plains have some of the same concerns. If the nearest hospital to you is across state lines, will you have coverage? I recognize what we're trying to do. We're trying to lower costs. We're trying to do all of these things. But sometimes a hammer is not the best tool in the toolbox. And if it ends up leaving some of our citizens uncovered without insurance coverage at the nearest hospital they can get to, then I think we've made a mistake. We do a lot of things here that end up with unintended consequences. I think this is one of those things that we could be doing with unintended consequences that we really have not had the opportunity to even talk about or to think about. I don't think we want to come back and recraft this at some later date with a different session of legislators. Tonight's the night. This is something that's concerning me. It's concerning the community that I live in. It concerns the communities that I represent. I'm hoping that before we vote on this, that I can get an answer for some of those folks that live in the 58th district. Because I will tell you that it's much tougher down there than what you think. Those hospitals operate on a lot of Medicaid and Medicare patients. In fact, I think there's about 70% that are of those kind of patients. Those hospitals are not doing well now. Those doctors are not doing as well as they could be. I'm sure if they moved to a bigger city, maybe their revenues would go up. But you know, there's something about living out there that causes us to decide we want to stay. I've spoken to some people that live in the city, and I talk about some of the issues that we deal with. I've had it actually said to me, well, you know, maybe you ought to move closer to the city where there's more services. And being about half of a smart aleck, I said, well, maybe you ought to move closer to your food. Because that's really what we're talking about. Those areas are a big part of the state of Colorado. Bigger than what we sometimes think about. It's a big part of what funds Colorado. Agriculture, mining, logging, timber. Those kind of jobs are the ones that are out there. They've never paid real well, but they're not paying as well today as they have. You know, I want better coverage. But I don't think forcing something onto the market is going to be the answer for these communities that are already hurting. In my life, the places where have said to me, if you don't, we will do this, have not been the places I've done business with. When I was a kid, I asked, well, let's see that. I've never seen it before. Let's go and find out. There's a lot of folks in the state of Colorado that are going to feel that same way. I think we could be more creative. I think that we could be looking towards marketplaces rather than forcing marketplaces. That we would let that creative juice start to flow in the state of Colorado. But instead, we're going to use fines and we're going to make demands. Ladies and gentlemen, I'm afraid it will not work. My whole life I've had a saying about if I had to whittle my square peg to fit the round hole, it probably wasn't a good deal. And that's proved out in a lot of the jobs I've had. If they fit together quick, you know it's going to work. If you have to force it to get it to work, it usually hasn't. And if it did, it would fall apart sometime in the future. I'm hoping that we will not force this into the marketplace and set Colorado aside. We're just now getting wind up under our wings on an economic basis. We need these new doctors. We need these people to stay. I'm concerned. You know, the doctors in Montrose saved my mom's life about 12 times in 3 years, literally. Man, it would have been really tough if those guys hadn't have been there, because they were Herculean in some of the efforts they put forth. And I'll always be thankful for them and respectful of what they did for my community, for my family, and for my mom. Let's not lose any of that kind of caliber of people in the state of Colorado. We really can't afford to lose it. And if they're writing us letters saying, I think I'll have to move, it's in their mind. Let's not encourage them to leave the state of Colorado. And before we vote on the third vote, I would like to find out whether or not my citizens will have coverage if they go out of state for treatment. And you might want to ask that question. Would some of your citizens, if they leave the state of Colorado with that insurance, will they be covered when they take a vacation? Will they be covered if they go to a different city to work on a business trip? Those kind of things. We have problems with insurance in the state of Colorado. We've worked hard on it. Surprise billings and some of those kind of things. We've put a lot of effort into this. I'm going to ask you tonight, please vote no.
Representative Rich.
Thank you, Madam Chair. I haven't heard from anyone in the county that I'm from, which is Mesa County, that supports this bill. I've heard from a lot that don't. But I do want to review what's in this bill, even with the strike below portion of the bill. Health plans are required to offer the standardized plan in each county across the entire county where they operate in the small group or individual markets. Health plans shall offer the standardized plan at a premium rate that is at least 18% less than the premium rate for the health care benefit plans that the carrier offered in the 2021 calendar year, adjusted for medical inflation. Health plans are required to undergo public rate hearings when they are not able to offer the public option at the mandated premium reductions. Hospitals are required to participate in the public option program. Hospitals are required to accept government set rates if the Commissioner of Insurance determines that is necessary to achieve the mandated premium reductions and/or network adequacy. Healthcare providers are required to participate in the public option program. Healthcare providers are required to accept government set rates if the Commissioner of Insurance determines that is necessary to achieve the mandated premium reductions and/or network adequacy. Health plans can be required to offer the standardized plan in counties where they don't even operate, or if the Commissioner of Insurance determines that is necessary. I know they call it the Colorado Plan because they didn't want to call it the public option because it's not an option, it's a mandate. I'm asking for a no vote.
Representative Carver.
Thank you, Madam Chair. I'm not going to read any more letters. I have a huge number of doctors in my district. The vast majority of doctors that practice in the Pikes Peak region live in my district. And I just want to touch on a couple of points that they've brought to my attention beyond the mandatory participation, which they're quite frankly outraged by, and at fixed rates. Some of the other points they bring up that are of great concern is their plans and those of their colleagues already looking at moving to other states. And this is very real. It's in every letter I've received, and I have received a lot of letters. So you take that in a county that is growing fast like El Paso, within reach of 700,000, doctors looking at moving, and at the same time within their practices having great difficulty, and this just complicates it, in bringing new doctors into their practice areas. Letter after letter, especially if they were senior in their practice, talked about the difficulty of bringing new doctors in and how this will make it even harder. As doctors have a choice between coming to Colorado and practicing under these conditions versus going to another state. And I think the final point is just the absolute fatigue and stress that they convey in their letter. Letter after letter, like we've gone through all of this. We've lost colleagues. We've worked 18-hour days for the last year. And now the legislature is going to do this to us? You're going to do this to us after the year we've had? I ask for a no vote.
Is there any Representative Geithner, or I'm sorry, Assistant Minority Leader Geithner?
Thank you, Madam Chair, and no worries. Members, I rise in opposition of 1232. We started this at approximately 5 p.m. I think we've run somewhere near 28 amendments. We still have some cows to go. And coming out of El Paso, I have to agree with a lot of what Representative Carver mentioned, and that is I'm receiving similar emails where there is concern about, is it time that I move my practice? Is it time that I look to another state? Very much predicated on the same level of concern around COVID and everything that those physicians have endured over the last year plus. I think the mandates that are in this in terms of the requirements of what the physicians are forced to do at the rates that they're forced to do that at is egregious. It's a manipulation of the market. And I know that the effort is to attempt to try and drive down the cost. And I've been trying to sort this out, and I got an email from an economist, a friend of mine, and it was very brief. He's probably one of the smartest guys I think that I've come across as I've spent some time in this body. And his question was pretty simple. It's one sentence. And it's what has kind of stuck with me, and it's where I'm still at now. And as an economist, he simply just writes, he says, how do you cure a market failure? By imposing a bigger market failure. Members, I urge you to vote no on this bill.
Representative Sandridge.
Choke. Thank you, Madam Chair. I have to, you okay? I have to agree with my colleagues from El Paso County. I'm pretty fortunate in my district. We have some great, is Matt Gray watching? So I'm drinking at the well. I just want to make sure Matt Gray's watching. Thank you. So I have many great hospitals in my district. Children's Mercy and St. Francis and Memorial North, and we're building another one. So I'm really fortunate. And what obviously we get a lot of communications about concerns, but I wish this was more balanced in our conversations, because it seems like we have a lot of people, different groups. I have flyers on my desk that show these different groups that are concerned. And I don't want any to throw out any gotcha anything. I just would like to know the groups, like the doctors, not pro this group, but like or professional groups, professional doctor groups, groups associated with administrators of hospitals. And I would like some type of balance, for maybe if we have a group over here that's concerned, we have a group over here that thinks it's the greatest thing in the world. Do we have an abundance of, because I wasn't associated with the stakeholding, do we have an abundance of professionals in the hospital industry, professional doctors, who think this is great? I'm not saying neutral. I'm saying this that have came out and said, this is great. This will really help our state. I want to be part of a hospital that takes part. I want to be part of a state that takes part in this. And I'm willing to withstand the regulations, and I'm willing to withstand the price caps, and I'm willing to withstand the regulations because I think this is great. And that's what I would like to hear. Is there, because it seems like we're getting, I don't want to just get one side of the story. I'd like to hear more. Who likes us? Who thinks this is going to help? Not just neutral. Who thinks this is really going to help us? And not advocate groups, but doctors. Do we have doctors, a set of doctors who think this, I've read it, I love it, I want to be part of it? It'd be great to hear that. I'd like to know it. Thank you.
Thank you. Representative Roberts.
Thank you, Madam Chair. Thank you, Representative Sandwich. You had a letter placed on your desk this morning from physicians all across the state that support this bill. I'd encourage you to take a look at it. There are doctors from all over the state, including El Paso County, on this list.
Representative Bradfield.
Thank you, Madam Chair. I'm looking at an article that was published in March, but it still is in regards to this bill. And it is from the Colorado Healthcare Future. And I just wanted to share with you the opinions of two people that wrote in. One is Kathy Schall. She's the executive director of Pro 15. And she says Colorado's hospitals do not operate in a silo. Our healthcare system is fully integrated, yet rural residents are asked to trust that officials will be able to account for the countless conditions unique to each rural community. Our unified healthcare system is much larger than one physician, one hospital, and one health system. By our healthcare leaders and state officials collaborating and working together broadly across the state, patients receive better care and ultimately lives are saved. Although it is often challenging, Colorado's rural healthcare networks are on the right path. Coloradoans shouldn't have to sacrifice quality of care, access to care, and their insurance coverage on a short-sighted solution to a complex issue. Lawmakers can do better and find solutions that will not put an unsustainable burden on Colorado's healthcare system and rural communities. A public option, insurance option, is too consequential to be left to chance. Jeff Keener, President and CEO, South Metro Denver Chamber of Commerce. The Colorado legislature is debating whether to a public option insurance plan to the choices already available on the state's Connect for Health Colorado Insurance Exchange. But a state-level public option simply isn't justified by the facts on the ground. Data from the Polis administration has shown that low and middle-income families who have government-subsidized health care premiums would actually pay more every month for their insurance if the government-controlled plan became a reality. When it comes to public policy, particularly on a matter as significant as a government-run healthcare system, facts and data matter. We simply cannot afford to make mistakes when it comes to our healthcare system. Ladies and gentlemen, I give these two people, experts in this field, I would think that should give us all pause to think about this bill and whether it is the right way to go forward. Thank you.
Representative Pico.
Thank you, Madam Chair. I want to respond to that. We have a letter on our desk from all doctors from all over the state. Well, we've heard from a lot more than that. Doctors all over the state. We've heard from the doctors' organizations, different medical facilities, physicians groups, from the hospitals, the hospital groups, the insurers, and we've heard from businesses that they're not in favor of this bill. Businesses are going to leave, doctors are going to leave, businesses are going to stop coming here. You can't just wave a government fiat and say you're going to have lower costs. You're going to mandate payments below the cost levels. That's a fact. We've heard that loud and clear. Throwing a simple letter on our desk from some small group doesn't cut it. Vote no on this bill. This is going to be a disaster.
Is there any further discussion on HB 21-1232? Representative Sandridge.
Thank you, Madam Chair. And I appreciate, I actually didn't have one of these flyers associated with Committee to Protect Healthcare Colorado chapter. So I was able to, I thank Representative Carver for letting me have her copy. So obviously I'm from Colorado Springs, and we're the largest county in the state. And we've got hundreds of emails. And with the addition of this, and it's an advocacy group there's a Colorado chapter. With the addition of this, and again, I'm from the largest county of the state. If you look at this and the emails I received from the largest county, I can think of 5 doctors who are in support of this. And what's interesting, I met with some administrators from, what was it, Memorial North. They were adamantly against it. So largest county, as far as I know, I have 5 doctors, which I'm sure I'll do some history on. One's a dentist and a psychiatrist. So, that's where I come back to saying if you have these administrators from the professionals who run these hospitals, we listen to Representative Soper, who has a considerable experience because he's on the board, saying this is bad. And what I'm curious is, are there anybody in any counties, and I'm more concerned about the rural counties, I'll tell you the truth. Has anybody talked to any administrators of rural hospitals that think this will help them provide better care and cheaper care? Because on both sides of the aisle, that'd be great if there's somebody who can, maybe you got receiving an email from your constituents or somebody, a administrator in your district that said this is great. Bring it on. It'd just be nice to hear, because I know the ones in my area have said it's a bad thing and it's going to be worse for rural areas. And I know most of the rural areas, I guess this is maybe a question for most of the rural representatives are on my side of the aisle. If anybody has anyone who came to you and said this is a great thing, I'd love to hear it to relieve my concerns. But as the largest county, I can, from all the probably 107 emails, I have five doctors and a dentist and a psychiatrist from advocacy group. That's where I get concerned when the argument's so lopsided and we're trying to really grasp what's going on. When you have over and over professionals in an industry saying this will hurt us, but the politicians telling them, no, they won't. But then the professionals saying, but I work in this industry and I run this hospital, it's going to hurt me. But then we say, no, it won't. When they say the price caps, we're struggling right now and the price caps will hurt us. And then we just say, no, it won't. Like we know better how to run that hospital than they do. So that's where it's just where 2 and 2 was not adding up to 4 in this. Because personally, I think it'd be a great thing if we could get the hospitals in my district to come to me and go, or a doctor, at least one doctor in my district to come to me and go, Shane, you need to vote for this. This is great. But it's all 95%, it's not great, and maybe a 6 that are against. So that's where it's just not adding up. You know, some of these different bills, you get 60-40 or kind of down the middle. But I get these professionals, they're just saying this just doesn't add up, especially in the rural area. So, like I said, if there's anybody in here who's had administrators that have came to them and said, this is great, love to hear it. It may be Representative Soper, from his experience, knows somebody with opposing views. That'd be great to hear, too. Also, it'd be nice just to get different views, too. I know we have a physician here, and we have a nurse here, and it'd be nice to get some views on that in support of it, how it would affect. And maybe that would relieve some of our concerns. It'd be nice to actually walk out of here, whenever we walk out, going, this plan's really not as bad as I thought, but I'm not quite getting there. So I know our people, we still have some people watching, and they're messaging me, and would like some of these different viewpoints and some of these concerns addressed. Thank you.
Is there any further discussion on HB 21-1232? Seeing no further, Minority Leader McKean.
Thank you very much, Madam Chair, and I'll be quick, because it was the decision whether or not to get up and talk about this one last time. I think it's worth getting up and talking about it one last time. I think it's worth talking about where this started, where it's gotten to, and where it goes from here. Where this started was really what I knew, Representative Roberts, was something that was a passionate desire of yours. And I think we all come here with that, and we all come with a need to see the things that we believe so strongly and get done. And I respect that. We'll agree with what you wanted to get done, but I respect where you come from on it. And it's very different now from what it was. And I think that has a huge story to tell about what I said in the beginning, how complex this problem is. How complex it is to move all these pieces in concert and have it work out. The word I gave you early on was if it can get to a place where everybody says, no, it's not perfect, no, we don't even like it, but we can live with it, then we get very quiet and we say, all right, give that a shot. It is with great disquiet that I don't think we got there. And I don't know if you can. That's really where I come to on this, is I think you've worked your tail off to get to where you are. And I don't know if you can get to that place. Not that makes people happy from a perspective of what they want, but really what they need to do the service and the work that they would do in the state. And that's always my worry, is if we take action on this in a way that I think harms our state, then I stand in the way. And I am joined by stalwart individuals who stand in the way to say we think this is bad for our state. And that is not as much philosophical as it is practical. And I think that the practical side of this says that this very complex problem, in many, many ways, cannot be solved by government intervention. This very complex problem is not waiting for a percentage to be given to arrive at a solution. This very complex problem is not waiting for us to say, if you don't take this, you will be fined. This very complex problem, I think, is in tremendous need of figuring out where that equilibrium truly lies. And I don't think this is it. I know it's not it, because every time we push at one of the corners, everything gets out of balance. And every time we suggest that it could find its own equilibrium, we have to add fines and penalties to make sure that people do what they're told. To me, that's a sign of something that is not in a stasis that works, and therefore is likely not a durable solution. And if it's not a durable solution, and it affects a visceral need of the people of this state, then I stand in the way. I urge an aye vote on this bill. Pardon me, I urge a no vote. I urge a no vote on this bill. But I'm glad you were listening, and that's important at whatever time it is in the morning. No, I do. I urge a no vote on this bill, and I urge it because we ought to do better, and it's not because work wasn't done. Tremendous work was done. I think it is truly because this problem did not naturally arrive at this solution.
Is there any further discussion on HB 21-1232? Seeing none, the question before us is the adoption of HB Representative Lynch.
Thank you, Madam Chair. Bad bill. Vote no.
Appreciate your brevity. Representative Roberts.
Thank you, Madam Chair. Thank you, members, for your lively debate and attention this evening and this morning. When I became a state representative 3.5 years ago, the very first email I received into my new state email address was from an individual in my district who said, please do something about the cost of health insurance in western rural Eagle County. My wife and I are going to have to leave because we can't afford to live here, and my wife has a health issue and we can't afford our insurance. This bill is a narrowly targeted, careful, and deliberate approach to a problem we have in our state, particularly in rural Colorado. Every single one of us has constituents going to bed tonight or already gone to bed worrying about their family's health insurance because of the cost. To do nothing is unacceptable. We heard a lot about what people think is wrong with this bill tonight, but we didn't hear a lot of alternatives. That's because this bill is the right way forward. It's narrowly targeted, it's carefully crafted, it has achieved the neutrality of almost all of the healthcare industry. It is a step we need to take forward for people in Colorado. This is about people's lives. This isn't about protecting the status quo. This is about our constituents who deserve affordable health insurance. I ask for an aye vote on House Bill 1232.
Is there any further discussion on HB 21-1232? Seeing no discussion, the question before us is the adoption of HB 21-1232. All in favor, please say aye. Aye. All opposed, no. The ayes have it. HB 21-1232 is adopted. Madam Majority Leader.
Thank you, Madam Chair. I move to lay over Senate Bill 162, House Bill 1274, House Bill 1150 until later today.
We will move those bills to later, lay those bills over to later today. Madam Majority Leader.
Thank you, Madam Chair. I move the committee rise and report.
Okay, if you've heard the motion, seeing no objection, we will rise and report.
Okay, the House will come back to order. Mr. Gregorio, please read the report of the Committee of the Whole.
Mr. Speaker, your Committee of the Whole begs leave to report it is under consideration the following attached bills, being the second reading thereof, and makes the following recommendations thereon. House Bill 21-1232, as amended, passed on second reading and ordered engrossed and placed on the calendar for third reading and final passage.
Representative Kipp. You have heard the motion. There are amendments at the desk. We will go alphabetically, and we will start with the Geithner amendment to the report of the Committee of the Whole, which is L100.
Representative Geithner moved to amend the report of the Committee of the Whole to reverse the action taken by the committee in not adopting the following Geithner Amendment L100 to House Bill 21-1232 to show that said amendment passed and that House Bill 21-1232 as amended passed.
Assistant Minority Leader Geithner.
Thank you, Mr. Speaker. Members, I move the Geithner Amendment to the Committee of the Whole.
That amendment has been properly moved and displayed. Is there any further discussion?
I ask for a favorable or a yes vote.
Seeing no further discussion, the question before us is the adoption of the Geithner Amendment L100 to the report of the Committee of the Whole. Mr. Gregorio, please open the machine, and members, please proceed to vote. Okay, those participating remotely. Representative Burnett, how do you vote?
No.
Representative Burnett votes no. Representative Gray, how do you vote?
No.
Representative Gray votes no. Representative Jackson, how do you vote?
No.
Representative Jackson votes no. Representative Exum, how do you vote?
No.
Representative Exum votes no. Representative McLaughlin, how do you vote?
No.
Representative McLaughlin votes no. Representative Ortiz, how do you vote?
No.
Representative Ortiz votes no. Representative Michelson-Janae, how do you vote?
No.
Representative Michelson-Janae votes no. With 23 aye votes, 37 no votes, and 5 excuse. Oh, I'm sorry. Please close the machine. With 23 aye votes, 37 no votes, and 5 excuse, the Geithner Amendment to the report of the Committee of the Whole is lost. Mr. Gregorio, please read the Lynch Amendment L68 to the report of the Committee of the Whole.
Representative Lynch moved to amend the report of the Committee of the Whole to reverse the action taken by the committee in not adopting the following Lynch Amendment L68 to House Bill 21-1232 to show that said amendment passed and House Bill 21-1232 as amended passed.
Representative Lynch.
Thank you, Mr. Speaker. I'd like to move the Lynch Amendment.
It has been properly moved and displayed. Is there further discussion? Representative Lynch?
What's that? No discussion.
Okay. Seeing no further discussion, the question before us is the adoption of the Lynch Amendment L68 to the report of the Committee of the Whole. Mr. Gregorio, please open the machine, and members, please proceed to vote. Those participating remotely, Representative Burnett, how do you vote?
No.
Representative Burnett votes no. Representative Gray, how do you vote?
No.
Representative Gray votes no. Representative Jackson, how do you vote? Sorry, Representative.
No.
Representative Jackson votes no. Representative Exum, how do you vote?
No.
Representative Exum votes no. Representative McLaughlin, how do you vote?
No.
Representative McLaughlin votes no. Representative Ortiz, how do you vote?
No.
Representative Ortiz votes no. Representative Michelson-Janae, how do you vote?
No.
Representative Michelson-Janae votes no. Representative Bradfield. Please close the machine. Thank you, Representative Lynch. With 23 aye votes, 37 no votes, and 5 excuse, the Lynch Amendment to the report of the Committee of the Whole is lost. Mr. Gregorio, please read the first McKean Amendment to the report of the Committee of the Whole, L66.
Representative McKean moved to amend the report of the Committee of the Whole to reverse the action taken by the committee not adopting the following McKean Amendment L66 to House Bill 21-1232 to show that said amendment passed and House Bill 21-1232 as amended passed.
Minority Leader McKean.
Thank you very much, Mr. Speaker. Strong finish, Mr. Gregorio. And I move the first McKean Amendment to the report of the Committee of the Whole and ask for a favorable vote.
It's been properly moved and displayed. Is there any further discussion? Seeing none, the question before us is the adoption of the first McKean Amendment, L066, to the report of the Committee of the Whole. Mr. Gregorio, please open the machine, and members, please proceed to vote. Representative Burnett, how do you vote?
No.
Representative Burnett votes no. Representative Gray, how do you vote?
No.
Representative Gray votes no. Representative Jackson, how do you vote?
No.
Representative Jackson votes no. Representative Exum, how do you vote?
No.
Representative Exum votes no. Representative McLaughlin, how do you vote?
No.
Representative McLaughlin votes no. Representative Ortiz, how do you vote?
No.
Representative Ortiz votes no. Representative Michelson Janae, how do you vote?
No.
Representative Michelson Janae votes no. Please close the machine. With 23 aye votes, 37 no votes, and 5 excused, the first McKean Amendment to the report of the Committee of the Whole is lost. Mr. Gregorio, please read the second McKean Amendment to the report of the Committee of the Whole, L102.
Representative McKean moved to amend the report of the Committee of the Whole to reverse the action taken by the committee in not adopting the following McKean Amendment, L102, to House Bill 21-1232 to show that said amendment passed and House Bill 21-1232 as amended passed.
Minority Leader McKean.
Thank you, Mr. Speaker. I move the second McKean Amendment to the report of the Committee of the Whole. Ask for an aye vote.
Is there any further discussion? That has been properly moved and displayed. Seeing none, Mr. Gregorio, the question before us is the adoption of the second McKean Amendment to the report of the Committee of the Whole, L102. Mr. Gregorio, please open the machine, and members, please proceed to vote. Representative Burnett, how do you vote?
No.
Representative Burnett votes no. Representative Gray, how do you vote?
No.
Representative Gray votes no. Representative Jackson, how do you vote?
No.
Representative Jackson votes no. Representative Exum, how do you vote?
No.
Representative Exum votes no. Representative McLaughlin, how do you vote?
No.
Representative McLaughlin votes no. Representative Ortiz, how do you vote?
No.
Representative Ortiz votes no. Representative Michelson Janae, how do you vote?
No.
Representative Michelson Janae votes no. Please close the machine. With 23 aye votes, 37 no votes, and 5 excused, the second McKean Amendment to the report of the Committee of the Whole is lost. Mr. Gregorio, please read the third McKean Amendment to the report of the Committee of the Whole, L103.
Representative McKean moved to amend the report of the Committee of the Whole to reverse the action taken by the committee in not adopting the following McKean Amendment, L103, to House Bill 21-1232 to show that said amendment passed and that House Bill 21-1232 is amended passed.
Minority Leader McKean.
Thank you, Mr. Speaker. I move the third McKean Amendment to the report of the Committee of the Whole. Ask for an aye vote.
Is there any further discussion? Seeing none, the question before us is the adoption of the third McKean Amendment to the report of the Committee of the Whole, L013. Mr. Gregorio, please open the machine, and members, please proceed to vote. Representative Burnett, how do you vote?
No.
Representative Burnett votes no. Representative Gray, how do you vote?
No.
Representative Gray votes no. Representative Jackson, how do you vote?
No.
Representative Jackson votes no. Representative Exum, how do you vote?
No.
Representative Exum votes no. Representative McLaughlin, how do you vote?
No.
Representative McLaughlin votes no. Representative Ortiz, how do you vote?
No.
Representative Ortiz votes no. Representative Michelson Janae, how do you vote?
No.
Representative Michelson Janae votes no. Please close the machine. With 23 aye votes, 37 no votes, and 5 excused, the third McKean Amendment to the report of the Committee of the Whole is lost. Mr. Gregorio, please read the fourth McKean Amendment, L078, to the report of the
Representative
Committee of the Whole.
McKean moved to amend the report of the Committee of the Whole to reverse the action taken by the committee in not adopting the following McKean Amendment, L78, to House Bill 21-1232 to show that said amendment passed and House Bill 21-1232 as amended passed.
Minority Leader McKean.
Thank you, Mr. Speaker. I move the fourth McKean Amendment to the report of the Committee of the Whole. Ask for an aye vote.
It's been properly moved and displayed. Seeing no further discussion, the question before us is the adoption of the fourth McKean Amendment, L078, to the report of the Committee of the Whole. Mr. Gregorio, please open the machine, and members, please proceed to vote. Representative Burnett, how do you vote?
No.
Representative Burnett votes no. Representative Gray, how do you vote?
No.
Representative Gray votes no. Representative Jackson, how do you vote?
No.
Representative Jackson votes no. Representative Exum, how do you vote?
No.
Representative Exum votes no. Representative McLaughlin, how do you vote?
No.
Representative McLaughlin votes no. Representative Ortiz, how do you vote?
No.
Representative Ortiz votes no. Representative Michelson Janae, how do you vote?
No.
Representative Michelson Janae votes no. Please close the machine. With 23 aye votes, 37 no votes, and 5 excused, the fourth McKean amendment to the report of the Committee of the Whole is lost. Representative Pico, come on down. Mr. Gregorio, please read the Pico Amendment L065 to the report of the Committee of the Whole.
Representative Pico moved to amend the report of the Committee of the Whole to reverse the action taken by the committee not adopting the following McKean Amendment L65 to House Bill 21-1232 to show that said amendment passed and that House Bill 21-1232 as amended passed.
Representative Pico.
Thank you, Mr. Speaker. I move the Pico Amendment to the report of the Committee of the Whole and ask for a favorable vote.
Has been properly moved and displayed. Thank you, Representative Pico. Is there any further discussion? Seeing none, the question before us is the adoption of the Pico Amendment L065 to the report of the Committee of the Whole. Mr. Gregorio, please open the machine and members please proceed to vote. Representative Burnett, how do you vote?
No.
Representative Burnett votes no. Representative Gray, how do you vote?
No.
Representative Gray votes no. Representative Jackson, how do you vote?
No.
Representative Jackson votes no. Representative Exum, how do you vote?
No.
Representative Exum votes no. Representative McLaughlin, how do you vote?
No.
Representative Exum votes no. Representative Ortiz, how do you vote?
No.
Representative Ortiz votes no. Representative Michelson Janae, how do you vote?
No.
Representative Michelson Janae votes no. Please close the machine. With 23 aye votes, 37 no votes, and 5 excused, the Pico Amendment to the report of the Committee of the Whole is lost. Representative Ransom. Mr. Gregorio, please read the Ransom Amendment L081 to the report of the Committee of the Whole.
Representative Ransom moved to amend the report of the Committee of the Whole to reverse the action taken by the committee not adopting the following Ransom Amendment L081 to House Bill 21-1232 to show that said amendment passed and that House Bill 21-1232 is amended passed.
Representative Ransom.
Thank you, Mr. Speaker. I move the Ransom Amendment to the Committee of the Whole and ask for an aye vote.
Is there any further discussion? Seeing none, the question before us is the adoption of the Ransom Amendment to the report of the Committee of the Whole L081. Mr. Gregorio, please open the machine and members please proceed to vote. Representative Burnett, how do you vote?
No.
Representative Burnett votes no. Representative Gray, how do you vote?
No.
Representative Gray votes no. Representative Jackson, how do you vote?
No.
Representative Jackson votes no. Representative Exum, how do you vote?
No.
Representative Exum votes no. Representative McLaughlin, how do you vote?
No.
Representative McLaughlin votes no. Representative Ortiz, how do you vote?
No.
Representative Ortiz votes no. Representative Michelson Janae, how do you vote?
No.
Representative Michelson Janae votes no. Please close the machine. With 23 aye votes, 37 no votes, and 5 excused, the Ransom Amendment to the report of the Committee of the Whole is lost. Mr. Gregorio, please read the Rich Amendment to the report of the Committee of the Whole L70.
Representative Rich moved to amend the report of the Committee of the Whole to reverse the action taken by the committee not adopting the following Rich Amendment L70 to House Bill 21-1232 to show that said amendment passed and that House Bill 21-1232 is amended passed.
Representative Rich.
Thank you, Mr. Speaker. I move the Rich Amendment to the report of the Committee of the Whole and ask for an aye vote.
Has been properly moved and displayed. Is there any further discussion? Seeing none, the question before us is the adoption of the Rich Amendment to the report of the Committee of the Whole, which is L070. Mr. Gregorio, please open the machine and members please proceed to vote. Representative Burnett, how do you vote?
No.
Representative Burnett votes no. Representative Gray, how do you vote?
No.
Representative Gray votes no. Representative Jackson, how do you vote?
No.
Representative Jackson votes no. Representative Exum, how do you vote?
No.
Representative Exum votes no. Representative McLaughlin, how do you vote?
No.
Representative McLaughlin votes no. Representative Ortiz, how do you vote?
No.
Representative Ortiz votes no. Representative Michelson Janae, how do you vote?
No.
Representative Michelson Janae votes no. Please close the machine. With 23 aye votes, 37 no votes, and 5 excused, the Rich Amendment to the report of the Committee of the Whole is lost. Mr. Gregorio, please read the Van Winkle Amendment L0106 to the report of the Committee of the Whole.
Representative Van Winkle moved to amend the report of the Committee of the Whole to reverse the action taken by the committee not adopting the following Van Winkle Amendment L106 to House Bill 21-1232 to show that said amendment passed and that House Bill 21-1232 is amended passed.
Representative Van Winkle.
Thank you, Mr. Speaker. I move the first Van Winkle Amendment to the Committee of the Whole. Ask for a yes vote for the people.
That has been properly moved and displayed. Is there any further discussion? Seeing none. The question before us is the adoption of the first Van Winkle amendment to the report of the Committee of the Whole, L106. Mr. Gregorio, please open the machine and members please proceed to vote. Representative Burnett, how do you vote?
No.
Representative Burnett votes no. Representative Gray, how do you vote?
No.
Representative Gray votes no. Representative Jackson, how do you vote?
No.
Representative Jackson votes no. Representative Exum, how do you vote?
No.
Representative Exum votes no. Representative McLaughlin, how do you vote?
No.
Representative McLaughlin votes no. Representative Ortiz, how do you vote? Sorry, one more time, Representative Ortiz.
No.
Representative Ortiz votes no. Representative Michelson Janae, how do you vote?
No.
Representative Michelson Janae votes no. Please close the machine. With 23 aye votes, 37 no votes, and 5 excused, the first Van Winkle amendment to the report of the Committee of the Whole is lost. Mr. Gregorio, please read the will amendment to the report of the Committee of the Whole, L084.
Representative Will move to amend the report of the Committee of the Whole to reverse the action taken by the committee not adopting the following McKean Amendment L084 to House Bill 21-1232 to show that said amendment passed and that House Bill 21-1232 as amended passed.
Representative Will.
Thank you, Mr. Speaker. I move the will amendment to the report of the Committee of the Whole and ask for an aye vote.
Has been properly moved and displayed. Seeing no further discussion, the question before us is the adoption of the will amendment L084 to the report of the Committee of the Whole. Mr. Gregorio, please open the machine and members please proceed to vote. Representative Burnett, how do you vote?
No.
Representative Burnett votes no. Representative Gray, how do you vote?
No.
Representative Gray votes no. Representative Jackson, how do you vote?
No.
Representative Jackson votes no. Representative Exum, how do you vote?
No.
Representative Exum votes no. Representative McLaughlin, how do you vote?
No.
Representative McLaughlin votes no. Representative Ortiz, how do you vote?
No.
Representative Ortiz votes no. Representative Michelson Janae, how do you vote?
No.
Representative Michelson Janae votes no. Please close the machine. With 23 aye votes, 37 no votes, and 5 excused, the will amendment to the report of the Committee of the Whole is lost. Mr. Gregorio, please read the first Williams and Van Winkle amendment to the report of the Committee of the Whole, L107.
Representatives Williams and Van Winkle move to amend the report of the Committee of the Whole to reverse the action taken by the committee not adopting the following Van Winkle and Williams Amendment L107 to House Bill 21-1232 to show that said amendment passed and that House Bill 21-1232 is amended passed.
Representative Williams.
Thank you, Mr. Speaker. I move the first Williams and Van Winkle amendment to the Committee of the Whole and ask for a yes vote.
See no further discussion. That's been properly moved and displayed. Seeing no further discussion, the question before us is the adoption of the first Williams Van Winkle Amendment L107 to the report of the Committee of the Whole. Mr. Gregorio, please open the machine and members please proceed to vote. Representative Burnett, how do you vote?
No.
Representative Burnett votes no. Representative Gray, how do you vote?
No.
Representative Gray votes no. Representative Jackson, how do you vote?
No.
Representative Jackson votes no. Representative Exum, how do you vote?
No.
Representative Exum votes no. Representative McLaughlin, how do you vote?
No.
Representative McLaughlin votes no. Representative Ortiz, how do you vote?
No.
Representative Ortiz votes no. Representative Michelson Janae, how do you vote?
No.
Representative Michelson Janae votes no. Please close the machine. With 23 aye votes, 37 no votes, and 5 excused, the first Williams and Van Winkle amendment to the report of the Committee of the Whole is lost. Mr. Gregorio, please read the second Williams and Van Winkle amendment L108 to the report of the Committee of the Whole.
Representatives Williams and Van Winkle move to amend the report of the Committee of the Whole to reverse the action taken by the committee in not adopting the following Van Winkle and Williams Amendment L108 to House Bill 21-1232 to show that said amendment passed and House Bill 21-1232 as amended passed.
Representative Williams.
Thank you, Mr. Speaker. I move the last Williams and Van Winkle amendment to the Committee of the Whole and ask for a yes vote.
Has been properly moved and displayed. See no further discussion. The question before us is the adoption of the second Williams and Van Winkle Amendment L108 to the report of the Committee of the Whole. Mr. Gregorio, please open the machine and members please proceed to vote. Representative Burnett, how do you vote?
No.
Representative Burnett votes no. Representative Gray, how do you vote?
No.
Representative Gray votes no. Representative Jackson, how do you vote?
No.
Representative Jackson votes no. Representative Exum, how do you vote?
No.
Representative Exum votes no. Representative McLaughlin, how do you vote?
Yes.
Representative McLaughlin votes yes. Representative Ortiz, how do you vote?
No.
Representative Ortiz votes no. Representative Michelson Janae, how do you vote?
No.
Representative Michelson Janae votes no. With 24 aye votes, please close the machine. With 24 aye votes, 36 no votes, and 5 excused, the second Williams and Van Winkle amendment to the report of the Committee of the Whole is lost. There are no more amendments at the desk. The question before us is the adoption of the report of the Committee of the Whole. Mr. Gregorio, please open the machine, and members, please proceed to vote. Representative Burnett, how do you vote?
Yes.
Representative Burnett votes yes. Representative Gray, how do you vote?
Yes.
Representative Gray votes yes. Representative Jackson, how do you vote?
Yes.
Representative Jackson votes yes. Representative Exum, how do you vote?
Yes.
Representative Exum votes yes. Representative McLaughlin, how do you vote?
Yes.
Representative McLaughlin votes yes. Representative Ortiz, how do you vote?
Yes.
Representative Ortiz votes yes. Representative Michelson Janae, how do you vote?
Yes.
Representative Michelson Janae votes yes. Please close the machine. With 35 aye votes, 25 no votes, and 5 excused, the report of the Committee of the Whole is adopted. That brings us to, I don't have a calendar in front of me, probably just moving into recess until later today. Oh, we'll do some announcements and introductions. Representative McCluskey.
Thank you, Mr. Speaker. Good morning, Appropriations Committee. We're going to be meeting in 5 minutes in the old... I'm joking. We'll be meeting at 9 a.m. tomorrow, 9 a.m. for Appropriations, Old State Library.
Today.
Same list that you...
9 a.m. today.
Today. Sorry, folks. After you sleep.
Representative Bockenfeld. Yeah.
Thank you, Mr. Speaker. It's an honor to serve with you.
Honor to serve with you too, Representative Bockenfeld.
Ladies and gentlemen, while you politicians were all horsing around this evening, my daughter-in-law was in labor. So I'm proud to announce I'm a grandfather again. I know I was up here a couple of weeks ago. I can tell you that the Bockenfeld boys have been busy. My newest grandson is Wyatt James Bockenfeld. He was born at 9:37 last night?
Yes, sir.
5 pounds, 12 ounces, and 19.75 inches long. So proud to welcome him into this world. Thank you.
Congratulations. Congratulations, Representative Bockenfeld. I have an announcement. The Senate did not concur with House amendments and has requested a conference committee be appointed for Senate Bill 17. The conferees will be Mike Weissman, Representative Weissman, Chair, Representative Larson, and Representative Woodrow. Representative Froelich.
Thank you, Mr. Speaker. If it's Friday, Representative Byrd wins with a 215.
Congratulations, Representative Byrd. I'm going to do a quick Majority Leader Escar.
We have a few more things to do before I put us in recess, but members, I honestly contemplated bringing us back at 9 a.m., but I feel sorry for the nonpartisan staff who has to be here because of our antics. So we will be coming back at 10 a.m. tomorrow, unless Sharon Approach, she'll be here at 9.
Okay.
Please clear off your filing desks, though, so they can go home now. Thank you.
All right, I have one Introduction of bills. Mr. Gregorio, introduction of bill.
Senate Bill 204 by Senators Donovan and Rankin, also Representatives Young and Van Bever, concerning an appropriation to the Department of Local Affairs for the Rural Economic Development Initiative Grant Program.
Senate Bill 204 will be assigned to the Committee on Agriculture, Livestock, and Water. All right, I think that concludes everything. Majority Leader Escar.
Thank you, Mr. Speaker. I move the House stand in recess until 10 a.m. today.
Seeing no objection, the House will stand in recess until 10 a.m.